Look, we get it. As a mental health clinician, your number one priority is, and should be, patient care. But there's always the administrative side of things, right? It can get pretty complex. So what we're going to do here is give you a quick start guide to cut through all that, to streamline the work so you can get back to what really, truly matters.
All right, so let's jump right in. We're going to be walking through the Carelon Provider Handbook. Now, I know what you might be thinking. A handbook? But try to think of this less like a big, scary rulebook and more like a roadmap for a really successful partnership. Seriously, it's all designed to support you in getting the best possible outcomes for your patients.
So here's the game plan. We've broken it down into 5 key areas that, pretty much follow the natural journey you take as a provider with the network. We'll kick things off with how to join, then get into the nitty-gritty of managing your practice day to day. After that, we'll tackle the clinical process, the all-important getting paid part, and wrap it all up with our shared commitment to quality. All right, Section 1. First things first, right? We got to get you into the network. This part is all about the credentialing process, and the goal here really is to make it as straightforward and painless as possible.
It really boils down to 4 simple steps. You've got the application, then verification, a committee review, and finally, notification. Now, here's a pro tip. See that mention of CAQH? That's the Council for Affordable Quality Healthcare. Using their system is, by far, the fastest way to get your application through the pipeline. It's the industry standard for a reason. It just streamlines the whole shebang.
So why all these standards? Well, it's all about building a really high-quality network. It's making sure every single provider has a current, totally unencumbered license, the right malpractice coverage, and is in good standing with big programs like Medicare and Medicaid. At the end of the day, this is the bedrock, the foundation of trust for the members we all serve.
Okay, so you're in the network. Awesome. Now let's talk about the tools and resources you'll be using for your day-to-day operations. This is all about making your practice run as efficiently as possible. Think of Provider Connect as your command center. It really is the one-stop shop for just about all your administrative needs. I mean, from checking a member's eligibility before they even walk in the door to tracking the status of a claim, it's all there. And because it's available 24/7, it's a huge time saver for both you and your staff.
And this is super important. This lays out the network standards for member access to care. It's pretty clear-cut. For emergencies, availability needs to be immediate. For urgent situations, you're looking at within 48 hours. And for routine appointments, within 10 business days. It's all geared towards one thing, getting people the right care right when they need it.
Okay, moving on to a really critical area, the clinical process. This is all about how authorizations and reviews work, and, really getting a handle on this is absolutely key to making sure there are no interruptions in care for your patients.
So at the very heart of every single utilization review decision, there's one fundamental question. What exactly is medical necessity? And this is so important to understand. Medical necessity isn't just some arbitrary concept. It's a concrete set of principles that make sure the care is directly tied to a diagnosis, that it follows nationally accepted, evidence-based standards, and that it's delivered in the safest, most effective way possible. It's not about what's convenient for anyone. It's about what's clinically appropriate and effective for the patient. And to make sure these decisions are objective, they're not just pulled out of thin air. They're all guided by industry-recognized, evidence-based clinical criteria. We're talking about things like ASAM criteria, which, as you probably know, is the gold standard for substance use treatment, or Interqual for a broad range of other behavioral health conditions.
The review process itself is really collaborative. It starts with a clinical care manager who does the initial review against those criteria. But, and this is a big but, if the request doesn't seem to meet the criteria, it doesn't just stop there. Nope. It gets escalated to a peer reviewer. That's another licensed clinician, someone in your field. And here's the absolute key takeaway. Only a peer reviewer, a fellow practitioner, can ever issue a clinical denial.
All right, let's switch gears and talk about something that's, pretty crucial for keeping the lights on: claims and getting paid. We want to make sure this whole process is as smooth as possible for you. If there is one number, just one, that you remember from this section, please let it be this one: 90. 90. You've got 90 days from the date of service to get that claim submitted. Hitting that timely filing window is honestly the single most important step to getting paid without any hiccups.
Next up, a really critical rule of being in the network. And let me be perfectly clear, this one is absolutely non-negotiable. NO, balance, billing.
So what does that actually mean? Let's be crystal clear. You absolutely can and should collect any applicable copays, deductibles, or coinsurance from the member. That's totally fine. What you cannot do is build a member for the difference between your regular charge and the contracted allowed amount for a service that's covered. That's the part that's off limits.
And here's the last little piece of the claims puzzle you're gonna need. For all your electronic submissions, the payer ID is BHOVO. That's Bravo, Hotel, Oscar, Victor, Oscar. Plugging that ID in makes sure your claims go exactly where they need to go with no detours.
Okay, last section. Let's wrap things up by talking about our shared commitment. This is all about us working together to maintain the absolute highest standards of quality and compliance. And a big part of that is understanding and preventing fraud, waste, and abuse. You'll hear the term FWA a lot. It stands for fraud, waste, and abuse. And it's a really big deal. Fraud is the intentional stuff, like billing for something you didn't do. Waste is more like overusing services, leading to unnecessary costs. And abuse is when practices don't line up with accepted medical standards. Preventing all of this is truly a collective responsibility. It's how we protect our members and the integrity of the whole system.
So, we've covered a ton of ground. To boil it all down, here are the top 3 things to remember for a great partnership. Number 1, use Provider Connect. Make it your best friend for all the day-to-day admin stuff. Number 2, file all your claims within that 90-day window using payer ID BHOVO. And number 3, always coordinate care with the member's other health providers. That holistic approach is so crucial. You know, we've gone through a lot of administrative details here, but it all circles back to one simple goal: to free you up, to take some of that burden off your shoulders so you can focus on the incredible work that only you can do. So the question I want to leave you with is this. With all these processes clarified, just think about how much more of your time, your focus, and your energy you can now pour back into patient care.